30 minutes? Oh my gosh, I know it's that long.
Minutes.
Oh my gosh.
Yeah, I think you'll be able to share a concept or two on comp planning.
All right. Good morning, everybody.
Good morning.
I love the enthusiasm. All right. Good morning, everybody. Good morning. All right, thank you. As Jeff mentioned, I'm Doug Foreman with Fringe Benefit Plans, and he's already stole one of my points. Is that we are a 50-year-old company started by my father, family business. My topic today is going to be about trends we're seeing in healthcare, trends that we're seeing in regards to compliance, and I'm going to touch a little bit on the Affordable Care Act, give you an update on what's happening in that world in regards to compliance. I do want this to be interactive. You guys have been a great audience so far with the questions, with everybody, so appreciate any questions that you have as we go through. Also afterwards, when I'm done, we are going to have a panel discussion. I'm going to point out a few items here because we want to, during the panel discussion, there's a couple items I'll point out that I want you to think about because we're going to look for your feedback in regards to what you're doing in your company and you're seeing in your industry as well. So a little bit about my background, born here in Orlando. Went to college at University of Florida, went to Lyman High School up there in Seminole County, did not go very far, and so love our Central Florida community, and being in the company being in town for 50 years, we have great community involvement and giving back to our companies as well as to nonprofits in the area. Question I have here is, anybody know what this number might represent? Unemployment? Somebody say unemployment? Yes. Yeah, I heard something else about wages. Did somebody say wages? No? Okay. All right, well, it's going to represent two items. One is unemployment, the lowest, of course, historically that we've seen. I'll point out a little bit later what 3.3 represents as well in another area. So this little graph, you've seen it before. But we are at the all-time low. Good news, bad news, right? Wonderful for the economy, not so great for the employers, as it's just things are tightening up for you in regards to recruiting and retention. I have this survey. You know, surveys are funny. Nate earlier said that people don't leave for higher wages, but this survey by Glassdoor says the percentage of workers voluntarily quitting their jobs is at an all-time high. I am hearing this from our clients. I actually, living it in my company, we have recently had one of my long-term employees who came to me, and she has had a terrific offer. She is going to another company that's going to pay her a higher wage, and it's less than a mile from her employer, from her work, and so she never has to get on I-4 again. Nice. And so I was like, I can't blame you for that. So what we're seeing now, one of the big trends is, and she says she was not actively working. That's what she told me. But we are hearing more stories about that. As Daryl mentioned earlier, I feel like she probably was recruited, and she's looked at it, more money, closer to her work-life balance is going to be a little bit better because her commute is much, much less. So I cannot begrudge her for that. And so I think we all are going to be feeling this. Has anybody else had a similar story with employees in their organization? Yeah, so I think we're going to see more and more of this as with this tight market. Employees are saying, all right, yeah, more money, better lifestyle, great opportunity. Can't pass that up. So, by the way, I'm actively looking for a new team member. I'll be checking out your LinkedIn accounts later. So, what are some remedies for this? Attracting the best and brightest, of course, the compensation, that's an easy one. Employee benefits, culture. We've touched on those. So those are the three areas that we see companies focusing on in regards to helping to recruit and retain. The other 3.3. So one of the other surveys that we've seen is that the expectation is wages are going to increase next year by approximately 3.3%. One of the highest we've seen in increases. Have you guys been budgeting that in your wages? A lot of companies the margins are getting better in certain industries. However, it's a big increase. Wages are typically the highest line item on your sheet. Next one is probably benefits. If you offer benefits, those are kind of the top 1, 2, and 3 in regards to your expenses. So this one have an expectation that it will be increasing roughly 3.3%. So one of the big areas and trends that we're seeing with our companies is the skills gap. So the skills gap is really coming because as we're seeing the younger generation coming in, one of the big things that they're looking for, of course, they'd like to have a significant wage, something that's meaningful for them. But a lot of times, the next generation, they are looking for a career path with their employer, and to have one that's specifically spelled out, even in your recruiting process, can be tremendous for you in your recruiting. They're looking for education, and some people, I hear some employers say, well, I don't want to educate my employees because I'll just educate them, they'll go get a better offer over here, and then they're going to leave. And yes, that is probably going to happen. But without doing that, you're going to have an employee that is not actively engaged. But to get them engaged is to have a career path for them in regards to, as part of your offering to them. So not only this new generation coming in, but also as, in my example, I'm losing a seasoned employee. And when earlier they were talking about how you're recruiting, and you got your IQ and your EQ, we're specifically, through things like predictive index that Jill's company does, we're looking for a specific type of employee that we want to have is going to be high energy, great customer service, not necessarily have experience in the insurance world, but we're looking again for more of that EQ. And so we have to have a path that we would have for this employee to help them to get educated in my world, but hiring more on their not necessarily their talent, but their energy level and not necessarily the experience. So that type of skills gap training is going to be important. So that's one of the questions, and I think with our panel, we're going to be asking you. So think about, I'd like to hear from you guys, not right now, but during our panel, what you guys might be doing in your industries or what you're seeing in trends regarding to address this skills gap issue. So we talked earlier about the compensation, of course, benefits. Core benefits still remain the backbone of an overall benefit program. The basics, of course, are health insurance, dental, vision, 401k retirement program. I earlier saw that the 3.3% increase in wages. Health insurance also is increasing cost for most employers. And most employers traditionally have been passing more and more of those increases on to their employees as an increase in their payroll deduction. So one of the areas we've been focusing on is working with employers about if you're increasing your wages, that increases your FICA taxes, increases your workers' comp taxes, increases your overall tax liability. So there's other soft costs that a lot of times you don't look at. But if you increase how much an employer pays towards your benefit packages, those are a tax deductible item. If you pay more towards your health insurance, it's a tax deduction, doesn't increase your costs in regards to the taxes. So, and it doesn't work for every single industry and company, but certain ones, it makes sense for them to say, all right, let's very consciously look at paying more towards our benefits, educating our employees what we're doing, that, hey, this is really part of your pay raise that we're doing for you, because more and more employees are looking at these benefits, what's their cost share as their overall benefit package. And with the market tightening, I've been in this business long enough, looking back 10 years ago, employers were cutting benefits, increasing wages. It wasn't as big, the benefits were taking a bit of a back seat, but we're seeing the benefit questions and the offerings being more front and center as the overall total benefit package. So what are the trends that we're seeing in health insurance? I mentioned earlier the increases. You read about them in the paper, about the increases. You're seeing them in regards to if you offer benefits, you have your annual enrollment. You probably dread that. And somebody comes in and says, oh, your rates are going up 12%, 15%, 30%. There's been some big numbers, especially when healthcare reform first entered the marketplace. About 7 or 8 years ago, we had some significant increases. We are actually seeing a lower trend in regards to health insurance. Most of the renewals that we've been presenting this year have been in the single digits, which has been very welcome. Had some flat increases as well. I was talking with Roy earlier, his company, he said, yeah, this year we got a flat increase. It's like, all right, high five. You don't hear about those very often. Question came up, we often get is why? Why are we seeing this trend? Couple of reasons, I think, is the healthcare reform was a big expense for insurance companies to swallow. There were expenses they had to pass on through the health insurance because of the additional taxes that the Affordable Care Act included in that act. So those have helped to flatten out the increases. The other one is, and you think about in your companies, you have seasoned employees that are reaching that wonderful age, nearing that age 65, and so they're transitioning off of your group health plan onto Medicare, and then as you're hiring, you're bringing in a younger population, and so health insurance is based on the average age of your group. So we're seeing employers, your population, your average age is decreasing, so that's helping with the decrease in overall trend of health insurance. Also, there's a lot more competition. There's really about 5 insurance companies out there, but they are getting more competitive in regards to their pricing. So, encourage you to shop. Competition is good in regards to looking at your pricing. So, take a look at what the other insurance companies have to offer. Depending on the demographics of your group, there's a type of insurance program called level funding. I'm not going to go too deep into it, but it is a program that has some partial self-insurance with protections in it. Sometimes you hear that and it's kind of scary to hear that word about partial self-insurance, but again, with the protections that these level funded programs have, they can be a very viable, low-cost way that you can offer health insurance to your employees, and typically makes sense for a healthier population, more centric employee population. So that would be something that you, as you're coming up on your renewal dates, perhaps mention that to whoever you're working with as something you want to look at. Executive level benefits. Back to this recruiting retention area. So they're on the top tier with the owners or top salesperson. There are benefit programs that you can offer in regards to health insurance that help fill the gaps on their deductibles and out-of-pocket expenses that are tax deductible. So that's another area that we try to focus on, is let's try to make these on a tax-efficient way in regards to offering benefits. And this can be, I know a lot of HR folks, you don't like to hear the term, but it is a benefit that can be offered on a discriminatory basis, just for some key folks that can be offered for that benefit.
Doug, I'm sorry, but just if you could give a little bit more definition to what that is, okay, with that plan.
A little more definition in regards to the the executive level benefits, yes, or the executive benefits. Yes. So the program, the way that works is, most employers, you offer a health insurance plan. It might have a $2,000 deductible and have office co-pays. This benefit, you can put it in again for the key folks where it would help fill that gap. If that employee has expenses that count towards that deductible, this executive benefit will help pay for that deductible for them. In addition, it can have some benefits where it might also cover their dental and their vision. It includes an executive level physical, which is, everybody with your basic benefit, you have your physical that you can go once a year to see your primary care physician. But this would be an executive level where you're going to the Rippey Clinic or to the Mayo Clinic an all-day, doing head-to-toe executive level benefit included. So again, catering to the upper echelon of your employee base, that the ones you're really trying to recruit, you want them to be healthy, focus on their job, so it's a benefit offered to them to help, so they don't have to worry about those out-of-pocket expenses, so they can have that physical, and it can include themselves as well as their family members, their spouse included in that benefit. Any other questions on how that program? Yes, sir.
Just a quick question. So if you're doing the executive level benefits, can you make those immediately upon employment? And then when you have your employees, then you have a 90-day, is there some kind of issue with that anymore?
So this executive level benefit, I think where you're going is, can you offer benefits quicker to certain employees versus
Right.
others? That part of the Affordable Care Act it was part of the Affordable Care Act, but it's been kind of gray, and it hasn't been fully defined. And so we are seeing a trend back to offering executives certain level of employees benefits quicker than others. So the answer is yes, you can, but again, it's a gray area that we're seeing in that law. Some of our clients are like, no, we want to treat everybody the same, but it is an area we're seeing you can offer benefits quicker for certain level employees. I think that's what you're asking?
Yes, sir.
Yep. So another trend is telemedicine. This is really speaking to the heart, especially of this younger generation. It is a benefit that can be offered, even if you don't offer major medical benefits. You can offer a telemedicine benefit to your employees. Relatively inexpensive program to offer, where they have 24/7 access to a physician through Skype or FaceTime. And so it could be 11 o'clock at night on a Saturday. This offering can include children, spouse and children in the benefit as well. So everybody who has kids, you know that they typically get sick roughly about 10, 11 o'clock on a Saturday night when there's no access to a pharmacy or physician. So just that comfort level knowing you can access a doctor, get that reassurance of what's going on. If a medication is needed, they actually could call in a medication for you. You pick it up the next day. Tremendous benefit for helping your employees save time, because if they are sick, they don't have to take the time off of work or for their family life on the weekend. Was there a question back? Yes, sir.
So do you see concierge medicine as a trend at all?
We are seeing concierge medicine as a trend for that executive level, and it really speaks to that same benefit. And that benefit that I was describing earlier, it includes that option as well. I forgot to mention that. Thank you, Alonzo. So concierge medicine is where instead of you have a physician, a personal physician that you have access to almost 24/7. Not the same as the telemedicine, but you can go see them as often as you want, and you don't have to wait in the waiting room. It's a defined period of time. So we are seeing that concierge level benefit for us, that top tier talent. Employers are offering that. So other trends that we're seeing, this speaks outside of the pure health insurance area. Employers are focusing on certain areas to help with recruiting, is tuition reimbursement, student loan reimbursement, and there are portions of this that can be a tax deduction. We could speak to that later. Agnes can, I think, address that in regards to the taxability and tax savings that you might have, if that's a benefit that you want to offer. But especially, again, with this next generation coming in, there is a significant amount of debt that they have in regards to their schooling, and you can spread out that payment to them over a number of years for help with that retention aspect of tuition reimbursement, or I'm sorry, student loan reimbursement. And the tuition reimbursement, that speaks to what I was talking about earlier, helping in with that skills gap. The next generation is really looking at a path. And if you have a way that you can reimburse them for outside education, that can be a tremendous benefit in regards to the recruiting retention aspect for your employees. Financial counseling, credit counseling, they don't teach this in school, and again, with this big debt coming out with this next generation, can be a great way to low-cost benefit that you can offer to them in regards to helping them deal with their financial situation. Everybody's heard of maternity leave? I always have a hard time with this. Maternity is for the
Mother.
thanks. Paternity is for the pop. You know, I try to keep the P the same. So for the father. So paternity leave, and a lot of these trends we're seeing coming from the West Coast, not from Tampa, but from California. Especially these tech companies that they're having employees more in our market. So we're seeing these trends in regards to the paternity leave for allowing the father to take time off to spend time with the newborn. And this one is always just, this one still gets me. The pet insurance, but you have your paternity and maternity. So if somebody has a new puppy, you can't leave the puppy home because it messes up the carpet. So having a defined paternity where an individual can stay home with their new pet at home to help acclimate them into the household. Unlimited PTO. Anybody here explored or offer unlimited PTO? Yes? Okay. Can you tell me more about it?
The idea was just to add a more ample benefit, and from my side, working in HR, it's much easier to not track
Yeah.
to a certain degree.
Do you mind sharing what your industry is?
Computer simulation.
Computers, okay, so technology.
And we found that those people were typically working a lot anyway. It wasn't a position where we would be speculating, how much time off have you taken. A lot of times when maybe they're not in the office, they're not tracking the PTO, so we said, we're going to kind of put to the side trying to track it and knowing that they're getting everything done, and it's much simpler.
I saw somebody else. No, so we only have one? Brian?
I actually saw an article that came out recently that said that companies that do not have a specific PTO policy as far as unlimited actually see people take less time off because they don't feel like they're losing anything. So when people are approaching the end, they start kind of getting concerned that I got to use my days because otherwise I'm going to lose them, and it forces people to kind of take more time off. And I saw it with our own company because we went from a set amount of PTO to unlimited, and a lot of the concern I got from my people was, I'm going to lose, what's going to happen? I'm going to lose my time. And it was trying to get rid of your home, understanding you're not actually losing your time, and now we just don't track that.
Mm-hmm. Yeah, and I don't know, so it was Sandy or somebody else over here who said that earlier in your career, you paid somebody 8 months of paid time off or something like that. Was that you that mentioned that?
Well, no, it was somebody that came to work for me with the company that I left, and joined me, but he wrote most of the, because he was my senior VP, he put most of the employee handbook and the policy statement.
Oh, he wrote it.
So when he,
I see.
5 years later, when he retired and started a franchise business or something else, he had accrued for himself like 9 months worth of.
I see, okay.
Mini
So
retirement there.
that's the fox watching the old hen house on the PTO. Okay, so lesson learned. I heard you say that earlier on that. But Brian's right. The trend we're seeing with this unlimited PTO, it is growing. Does not work for every industry. The IT technology makes sense, but not necessarily for hourly folks or for what you guys are doing, or the construction industry. So certain industries, unlimited PTO makes sense, and we are hearing the same thing. It's people are actually using less overall of time off with the unlimited PTO. With my company, we did implement unlimited PTO last year. It's been very well received. Did a lot of research on it and put in certain governors or restrictions on that, where it's like, next week I want to take the whole week off. We had to have a certain timeline that they would have to request the time off ahead of time. So because the big question you have is unlimited PTO, who's going to be here to do that work? So have plenty of planning in place. And again, it doesn't work for every industry, but so far it's been working for us. In regards to that unlimited PTO. Be happy to share that with anybody if you're interested in the language that we put into our unlimited PTO policy. Any other questions on that one? I usually get a lot more questions. Catering business? Probably not. No. All right. The Affordable Care Act, ACA, Obamacare. What's your favorite term? Anybody like? We're using more the ACA, the Affordable Care Act, versus it seems like the Obama tagline has been shifting away. The Affordable Care Act is really kind of sneaking up on people. It was passed many years ago now, roughly 7 years ago. The law first started having its teeth in 2015 in regards to the penalty, but we weren't seeing much action on that. People were like, oh, well, is it going to be really enforced? Is it not? Early on when the law came out, and you business owners might be in this category, some people would say, I'm never going to have more than 51 employees. I am going to manage my business to 49 employees, so I don't have to pay attention to that Affordable Care Act. And so it kind of goes in the back of your mind, and you forget about it. Then in 2016, there was a White House, the government passed a law that actually struck down part of the Affordable Care Act. It was the individual penalty. There used to be two penalties, the employer penalty and the individual penalty if you didn't have health insurance. So that part went away last year. And I think a lot of people also said, oh, it went away, it's gone. Good news, bad news, as companies have grown, those guys that folks that several years ago said, I'm never going to be above 51 employees. Good news is the economy is doing really well. So they have to start adding employees. And I think a lot of employers didn't realize, they said, well, I only have 40 full-time employees and I have these other 20 part-time employees over here, so I'm fine. But the law actually says it counts everybody pretty much on your W-2, part-time, seasonal employees, and they do this average over 12 months, a calendar year, to determine if you're over 51. So again, snuck up on them in regards to this potential penalty. So in March of this past year, the IRS started sending out letters for the year 2016. If a company was not in compliance for 2016, or based on the reporting that they did, because sadly there's reporting that you have to do for this Affordable Care Act. So the letters for 2016 penalty just went out in March. The letters for 2017 just started coming out in September. So they haven't even addressed 2018, let alone the current calendar year. And these letters, it's the official letter is called the 226J IRS letter. I don't know where the IRS came up with that number, but that's what they designated as. Started sending them out. Some employers like, oh, that's not real. But sadly, it is real, and they do need to be addressed timely. We have a solution for that. If you hear of somebody getting this letter, or if you've gotten this letter yourself, we have a way that it can be addressed for a relatively low expense. It costs roughly about $500 plus 5% of whatever the savings is to address the letter. Every letter that we've touched, we've been able to get it completely reduced, completely gone away, or reduced the penalty. One example was a grocery store that got a letter for $66,000. We were able to, and it takes a little bit of work, but you got to go back and look at when those employees were hired and terminated, and determine how many truly months they would have been eligible for benefits. But we were able to get that reduced to $18,000. Not a 100% win, but they were very appreciative of it. And employers, when the letter comes to you, it is a tax, so it has to be paid before you pay your debt and other obligations. So bankers are scared of this letter. I hear both sides from bankers. They like, oh no, this is going to affect the covenants. And Chris, if you have covenants and you have this big expense comes in, it can affect their payment and put them in a bad position. Other bankers say, oh no, this is a great opportunity for another loan. Because the employer may have to borrow some more money to pay for that penalty. but certainly have to address it. And again, it hasn't been employers that over the past 2 years haven't really thought about it. Now they're 51 employees. There's a lot of industries it does not make sense to offer a full major medical plan. It's very expensive. It's $500–600 per employee. But there are solutions out there where you can put in a lower cost program to address the Affordable Care Act in regards to offering a benefit package. Costs for those are roughly about $100 to $140 per employee per month to offer that benefit. But again, checks that box so that they would not, they'd be in compliance with this law. So again, if you see or hear of anybody that's getting this letter, or if you've got it, address it immediately. And if you are a company or know of a company not offering benefits, you can advise them that there is a solution out there for them to offer benefits, relatively low cost. So it probably doesn't apply to many of folks in this, it depends on your industry, but the landscaping industry and the restaurant industry, the grocery store I mentioned earlier, a lot of industries where they have not traditionally offered benefits, but now they have to, otherwise they will be receiving this penalty. Any questions regarding the Affordable Care Act? Has anybody seen or heard of this letter coming out to either your company or to peers? No? Okay. Yeah, well, it's sadly, we're going to hear more and more of it until the law is actually changed. Okay, so I think at this point, Jeff will transition over, unless there's any additional questions from me, I think we'll transition over to the
Exactly, to our panel.